Hello, my name is Anna Sulia. I am a doctor of physical therapy and owner of Inertia Physiotherapy here in Missoula. Thank you for listening to this episode of Missoula Health and Wellness Conversations, a video podcast where I sit down and chat with local health experts in the Missoula area about their business, the services they provide, what inspires them to do the work they do, how they've adapted to serving patients in the era of COVID-19, and any other topics that seem to catch our interest along the way. My goal with these conversations is to get to know local providers so I can help foster a network of caring practitioners and help the people of Missoula live their best lives. If you are interested in the services at Inertia Physiotherapy, please visit our website at www.inertiaphysiomt.com or call 406-880-7945. Refer to the video or the show notes to contact our interviewee of the day. Without further ado, I hope you enjoy this week's episode. Okay. All right. So good Monday afternoon, Missoula. Today, on Missoula Health and Wellness Conversations, I am excited to sit down and chat with Charlotte Creekmore of Folk Integrative Health. Charlotte is a family nurse practitioner deeply interested in holistic healthcare. She has a passion for helping men, women, and children, and she blends Western medicine with natural treatments. She's a busy mother of 3, and she's committed to the health of her family and yours. And so welcome, Charlotte, to this little podcast, or Zoomcast, as I've been calling them.
Thank you.
So tell me a little bit about, maybe to elaborate a little bit on your bio, and tell me a little bit about how Folk was born.
Oh, Folk was born because I had many years before I became a nurse and then a family nurse practitioner. I had many years as a licensed midwife in Montana and in IBCLC. So I was used to a really laid back atmosphere versus a stressful one. I was used to spending an hour and a half with someone and actually seeing their house and their family and their living room. And so when I went back to school, I really loved the Western medicine aspects of becoming a practitioner. But when I got out of school, being a mother greatly impacted, my ability to even work a 10-hour hospital day. Most nurse practitioner positions in hospitals are 4 10s or 5 days a week. And so as a mom of 3, I really my primary goal is to take good care of my kids and be here for them. So I was excited to be in private practice for various reasons and to open Folk to allow myself to have that space to take care of my family and take care of patients and feel like I could do that well. As a midwife, sometimes we just traveled with the smallest amount of medical supplies and a folder with some charts in it and no computers or anything like that. And so I'm used to sort of being a back to basics type of practitioner, and I was before getting into Western medicine. So I wasn't changing from years of amazing, fast-paced, intense hospital work to then downplaying that. I've always just been this type of practitioner. So that's how Folk was born. I mean, when I originally went back to school, my goal was to be in private practice so that I could mother and see patients and do what I love to do. So so that's, I guess, the basis of
Well, I think that's a really common well, let's see. I think wanting a more reasonable pace in a medical profession is a common driver for people to kind of form their own vision and go out on their own. I know it was for me. I worked outpatient orthopedics for I guess about 15 years. And starting at, 40 hours a week. And my first job, I saw, 30-minute appointments and probably 16 to 18 patients a day.
In,
And
it was as a
in
physical.
physical therapy. Yeah. And I don't really know if, I mean, that was as a new grad. I don't know how I could do that today. I certainly, sometimes I have a hard time sticking to my hour because there's just so much that I like to talk about and cover with people. And I spend extra time when I can. So going from that to, okay, now I have hour appointments, but I'm still working 10-hour days, and then becoming a mother, that really shifted the gears a lot, and it changed the priorities because I couldn't be there for 10 hours a day and complete the documentation and get home and still have energy for the little one. You know, it's just, I don't know, maybe had I done it at 27, it would have been different, but at 37, I didn't have the gas in the tank. So I think that combined with just kind of more of an evolution a little bit from more mainstream, and then through some of my own health challenges, as well as just seeing patients not responding how I wanted them to, I kept pursuing more physical therapy that was more integrative and whole person and less hyper focused and more holistic. And that started to not fit in the jar of a traditional clinic anymore. So yeah, so I that's why I opened my clinic, Inertia Physiotherapy, in 2019, just before the pandemic. So that's a great time.
I know, myself included in that.
Yeah, I know. That's kind of these young businesses. But how did this last year go for you? Are you finding a lot of success with telemedicine? How are you navigating COVID?
I've liked, so at the very beginning, it was all telemedicine, which sort of, pushes you right into having to do what you can do online without the
Mm-hmm.
physical exam component, which I miss. But it was a great way to get started because I didn't actually have a choice. It was sort of what everyone
Mm-hmm.
had to do. No one was going out and out and about to see practitioners unless more, urgent care related situations. So I've appreciated it because it gives me an opportunity. First of all, I'll always do telemedicine now with patients if they desire it from their home, or if they're still fearful about COVID. It's given me an excellent communication tool to be able to sit and talk to a patient. And although I miss parts of that physical exam, we can communicate really well. No, nothing wrong with, I love masking. I mask all the time, but
Mm-hmm.
it is harder to talk for the hour and a half that I want to talk to
Mm-hmm.
someone when I'm masked. And this allows me a way to be unmasked and to safely be able to communicate with the patient. So I've really appreciated it. And amazingly, using Doxy, the online platform, works
Mm-hmm.
well. And I had done some trainings with a different group that I work with for online, even physical exams. And these physicians were teaching how to do physical exam through Zoom. So immediately, I guess, the pandemic sort of stuck me right into telemedicine,
Mm-hmm.
which is definitely a creative aspect. Also, I had 3 children at home, homeschooling up until just recently, a week ago, a few days ago. So it gave me a chance to also be here with
Mm-hmm.
them safely while they were doing school. So oftentimes I'd do 2 patient visits and then have to run into a 3rd grader math class and then run downstairs and check on the high schooler and the middle schooler and then run back up and see another patient. And it's given me a chance to still be able to mother my children in the way that I wanted to and be able to see patients, although much
Yeah.
different than immediately starting during a pandemic and the start of the year with a job that was extremely demanding and stressed. I didn't even have childcare for the kids. So
Mm-hmm.
for me, it works really well with my personal life. And I find that that patient care really aligns the vibrancy and the ability of me to be able to give to patients in this scenario when I know my children are well taken care of is a little easier
Mm-hmm.
than if I thought they were home alone for 8 hours or whatever
For
it might
sure.
be. So, and
Yeah.
I expected various transitions. They'd be not in school for a while, and then maybe they'd go back, and what that looks like, and what the fall looks like compared to even the spring. Um,
Yeah.
it's given me a lot of time to focus on patients with starting a new business as well, instead
Mm-hmm.
of being just rushed and back to back and
For
kind of
sure.
it's been a nice gradual start, which has been pleasant.
Well, it sounds like, I mean, I think thinking about like what you're describing with like hour visits or hour night, even 90-minute visits, sounds like you're doing a pretty thorough history, which is a little different than most medical office visits. Kind of diving in a little deeper and maybe taking that toolbox down even lower than kind of a bare bones sort of home visit to like just questions and answers. Do you feel like do you catch anything in a different way when you're only sort of able to do things over telemedicine? Do you think about people's cases in a different way when you can only speak with them?
I mean, I do have, I think, compared to, we'll say clinical times, working in mainstream medicine, which I love aspects of that as well. I love the
Mm-hmm.
collaboration, the fast pace, all of that. At the same time, though, I used to get home and really just, I'll say, rack out, which I mean like lay horizontally on the bed and just be like,
Mm-hmm.
oh my gosh, make dinner be easy. And I didn't know if I wanted to spend a lot of time thinking um, during those times after I was done with work, although inevitably I would at different times in the shower, thinking about something at bedtime. Now I almost utilize some of that time because it is a little more relaxed to
Mm-hmm.
be able to think, oh, this person traveled to this country. What diseases could affect their colon, that they could have gotten in this other country? Maybe we should test for something like that. And then I find myself researching
Yeah.
and it's given me a chance to be able to do everything well, take care of myself, take care of my kids, take care of my patients well, I feel, by sometimes just accessing my home office, which is what you see here.
Yeah.
Instead of having to drive in somewhere, it gives me more time and ability to live my life, which I know this will change. I love going to the office as well. I have that downtown. But it's been reasonably pleasant. I think being able to see people without a mask on screen
Mm-hmm.
is really nice, I think, for people to visit and have that human connection. So
Nice. Are you
even over.
seeing anybody? Yeah. Are you seeing anybody in the clinic at this point or still doing everything?
Yes, I will see people in the clinic a few days a week. I do like to see people actually on Zoom first before we have to go in to say someone needs a vaginal exam. It's much more comfortable if we've talked for an hour and a half. We know
Mm-hmm.
what's going on as part of their women's wellness visit, for example. And then we know that when we go there, we're going to mask up and it's a little more limited on how we can communicate. And we kind of know already what we're going to do. I don't have to explain it. And so, I mean, I'm still explaining it, but you know what I mean.
Yeah.
They're more prepared versus us just quickly seeing one another with masks. And I just feel like the communication, it's been okay for that. And I'll probably continue that through spring, trying to see a patient online first before we go into the clinic, so that based on their comfort level, I'm currently vaccinated, but based on their comfort level, they may not want to be in there for very long. And so they're
Mm-hmm.
avoiding some healthcare care. So being able to see them online makes them be able to feel comfortable, and then they can be face to face for less time if they're not vaccinated, if they have COVID concerns still, and want to be fast. And sometimes if someone has on an N95 and a surgical mask over it, or double cloth masking, it can be a little harder to communicate
Mm-hmm.
depending on your age. I know in the 40s it can be. So I
For
know,
sure. Yeah.
I'm guessing any age, if you had hearing difficulties, if you are used to watching someone's mouth, an hour visit in person is challenging. But
Yeah. I have I started kind of trying to offer some telemedicine in response to COVID, but as far as physical therapy, it haven't had a lot of takers. I'm not sure it lends itself as well. There are probably a few conditions that do, especially acute things where you can kind of get like okay, this happened and then that's what you felt. And maybe even some more chronic things, but well, that tends to be my population is more chronic and persistent problems, and take it one step further, chronic and persistent problems that haven't really responded to other people's treatment approaches. So those are difficult people to treat effectively from home, because they've often done the sort of exercise route. And so my evaluation is very hands-on, and my treatment is very hands-on, and sort of tapers to less hands-on the as their body changes.
Yeah. And that makes sense.
Siri, what are you doing? Sorry, that's my computer trying to bring Siri into our life. Not sure why. Okay.
I'm expecting
Sorry about that. Little twitch.
A child to knock on the door at any point too.
Yeah, right. Mine could too. I told her I had to go upstairs and do an interview, so stay downstairs with me, Mom, but she may not. We'll see.
Exam. I find the ortho stuff when I'm doing it. Just to be honest with you, it is actually challenging to do. You have to, when you can visualize a rash or where someone is having pain, things like that, I can do very easily for physical assessment. But seeing someone has sacral issues going on and their lower back hurts, and I get them to point to it. I mean, it's just very challenging over the screen.
Yeah. So I think you can get a rough idea of where the pain, you can get a good idea of where the pain is, and you can get a reasonable idea of like global posture and movements, but you're not going to get much finite or precise detail about why they might do that. And I think that brings into the kind of integrative approach, or maybe kind of how the more holistic healthcare and what I try to practice in physical therapy sort of intersects, which is the what you see is not always why you see. Right. So someone has chronic back pain and they've seen a chiropractor and a massage therapist and a PT and an acupuncturist, and they're not getting better. What is the underlying cause? Because it's likely not that it's probably not their back. You know, you can see an x-ray and it's degenerative joint disease. Well, that's what, everyone has. So it's probably, we're not going to blame it on that. And the more like back pain patients I see, the fewer back pain problems I see. We're going to blame, the real issue is somewhere else. So those are hard to target. I've been fortunate that my clinic is really small. I did get vaccinated, and I think my size makes people a little more comfortable coming in. But it's also kind of funny when, I have people that I've known and they come in and I know their face, right? And I kind of know their body language and I know their expressions. And then the people that you come in and you're like, this is all you get. And it's a little funny to kind of imagine, what does the other half of this person's face look like? Because you only meet them in a mask. So I guess that's maybe the downside of only seeing.
Yeah. And it's fun to see people in a relaxed fashion. We're having a conversation. We're sitting in the talking. You get to see their boots, their snow boots. I mean, it's a very personal thing to be able to see people face to face and be able to see how they walk or how they move their body, or how they seem when they're sitting there. Are they fidgety? You can't really see as much of that when you're on.
Right. When you see kind of here, but the face tells you a lot. So I guess it's just digging into different parts of your brain to read people, is, facial expression versus body language. And maybe I'm saying it correctly, but
you mentioned something that I was going to comment on, that I also get, which is interesting that you get this. I also get sometimes very complex patients that come back from, get basic stuff, women's stuff, or rash or urinary issues, and, whatever primary care issues that someone has, or urgent care sort of issues. But those complex patients, I loved what you said about, so you've been to craniosacral, or you've been to PT, or you've been to massage, or you've been to acupuncture, and like it's still not happening, because really those things that you mentioned are really like the first go-tos for me for body things. If we're wondering why someone has an issue, of course there's diagnostics and et cetera, and using that technology to truly diagnose something going on. But sometimes there are no answers. So then you send someone there first, or they're getting relief, and then you're checking back in. And sometimes those complex patients, take a bigger box of a bigger type of thinking. Like I had said
Mhm.
sort of at the start of, okay, the specialist can't figure this person out. Wait, where was the last place that they traveled? I
Mhm.
remember this patient said that they got sick there. What illnesses are common there? I'm going to go look this up. What illnesses affect whatever systems? You know, it can get really interestingly complex in a different way than even Western medicine might think of. Although
Mhm.
I so appreciate Western medicine for establishing the parameters of um, practice. I mean, I
Mhm.
appreciate the diagnostic tools, medications that work quickly and fast, a lot of them, and protocols for how I'm supposed to practice as a family nurse practitioner. I love that. And I love to cover that. But then I think it's so amazing to think of the bigger picture, looking up things in a naturopathic textbook, a functional
Mhm.
medicine textbook, wondering if someone has PT, who are they going to, what are they getting there, or whatever
Mhm.
other modalities come into play to work. And I like that bigger
Yeah.
picture thinking. Um,
Yeah. I think that one of the big things as far as like, communicating as a physical therapist to whoever I speak to, but you as more, you as a family medical provider, you're kind of you have a lot of interventions that you help people with, but then you're kind of the quarterback, like you said, kind of like, oh, you sound like you might be good over here. You sound, you might get over here. And so I think, one of the really good things to know is just that just because one physical therapist didn't work doesn't mean physical therapy doesn't work, because every PT is going to, I think, I don't know. I mean, I haven't gone through medical training and in the more on that side, but I find that protocols are not terribly effective, and maybe they are if you just walk in the door with an ankle sprain. There's kind of some steps that you take, and you can, I say you can't really make them heal faster, but I think you can make them heal more completely, or you can help them heal more completely, and I think you can help them not make it worse before it gets better. You can't really speed up like a certain timeline of healing with an acute issue. You just say like, okay, protect the joint for this amount of time, start moving it, progress this way. When you start talking about these more chronic issues, I think it's there's just an umbrella of problems that could happen. And I think the training that I've gone through to kind of specialize in this area is called the integrated systems model. And basically it's starting like from a big view, right? 300, take a step way back and go answer those questions that some people aren't asking them, and going way back in their timeline and finding out, things like, well, I think I had a gentleman recently who I was working with, and he has this kind of chronic right back pain, and he's done a bunch of things to help it, but nobody really pointed out that maybe when he got hit by a car riding his bicycle and thrown from his bicycle 20 years ago, that might actually be playing into what's happening today, and that the timeline, kind of putting the timeline of their life together, starts to kind of make sense, because there are things that happen to you that get stored in your tissues, or adaptations that happen from even 10 or 20 years ago, or when you're a kid, that can affect you as you age. And maybe it's just aging, or maybe it's change of job, or in this case probably change of activity, turned 40 and decided to get super active, and so now his body's like finding these things that aren't, it's trying to compensate for some restrictions that aren't, and he's doing his best, but the output is back pain. So taking that whole timeline and taking that story first, like what are we really, what are we really dealing with, kind of getting a philosophy of, are there things I need to look up that are outside my scope, or is this person even in my scope? That's the first question, right? Because somebody could have a rheumatological condition, and maybe I can help them, but maybe I'm not the first step where they should be. Or maybe they do have some kind of just really weird GI thing, and that's, I can kind of give them some advice, but I'm not going to give them the workup that maybe you could, or even a further specialist could. And then from there, the question is, what system do I need to work in, and what system needs support? So most physical therapists are going to think about stretching, strengthening, maybe doing some neural glides, flossing, from some joint articular mobilization. But I take it a step further and I look at the visceral system, and I look really specifically in the neural tissue, which those two systems, not to generalize, but I think around 80 to 90% of people that are not responding to other therapies are going to have a significant finding in one or the other of these systems, or both, especially gut brain. This is really common, and there are mechanical ways that we can treat that. And what we do is we find the system and use a specific tool to address what we find, and then help them re-educate posture and movement and just mindset. And we kind of just repeat that process, pulling off as many layers as we need to until they feel better and they move better. And it doesn't work for everyone, but it works for a lot of things for people who have been told that they, probably just have arthritis, or they, probably just need to learn how to meditate. And maybe they do, but there might also be something else. Does that make sense? Kind of?
Well, and sometimes it's the journey of talking with someone and having the time to hear that it could be something else. And because when you're honing in, it's very interesting in clinical practice and in my situation, because I have the time to talk to them, and I know that you do also. I'm constantly sorting. It's like, that's what I'm getting paid to do, is I'm listening, I'm applying it to Western medicine, I'm thinking about natural aspects too and ways to treat. I'm also trying to sort some organization for them regarding mindset. And I think a lot of people say, oh, I cried during a visit, and I'm so surprised that I cried, and lots of women will talk about that, but oftentimes it's a mindset and a listening and being able to hear a little bit more when you stop to take that time instead of you had 15 minutes, and when you actually get to know patients, and it's not just a fly by night thing.
Yeah.
It
Well,
gives
I
you
think
that.
there's a lot of power in getting to know them and their story before you diagnose them. Because the other question that you answer that I have to ask myself, maybe not as, although I think that there's probably cases that this applies to you, is, are you even ready to engage in the process that would maybe get you where you want to be? Because I'm not a quick fix. There are people where sometimes they get kind of profound results quickly, but that may not mean that you're fully healed. It may not mean that that's the end of the line for you. And so if you're not willing to put in a little bit of work somewhere, or at least buy in to the process, then it's probably not going to work for you. And so kind of being able to try and determine readiness for change is another piece. And I think that's sometimes where the mindset piece comes in.
Being able to work with someone with what change might look like. And I found my personal practice, I love change. I love challenging myself. I love telling myself the truth about the resistance to change. Maybe I just want to floss in the shower only. And the dental hygienist asks you, I use this as an example. They ask you, so do you floss well? Your teeth are healthy. And I'm like, I do. I floss often. And then I'm like, oh gosh, I really floss when I'm in the shower only. So it depends on what week that is, what day that is. So it's an interesting thing to embrace change. And I find that constantly with some other practitioner friends, that we constantly challenge each other. One of my good friends is in Portland, who's a family nurse practitioner, and we're constantly saying, okay, really face that. Like, what is your exercise like during COVID? How does your body feel? Because if we're not asking ourselves for our own health, it's really hard to figure out how to motivate and how to help someone else to be able to find what they need to create those goals to make that change. And I had a friend say to me, she's like, you're so motivated. And I wanted to laugh and say, sometimes not. On the weekend, I'm not motivated. I really am relaxed. I like to not think very much and just enjoy. But at other times, I like to wake up and journal about how to embrace change, because for someone, they may not have an answer physically with you ever. They may not have an answer with me with a diagnosis and a treatment that works and something goes away.
Mhm.
And things don't always work that way in healthcare. So then the mindset has to change then in how to cope for the next 3 months, or how to make changes in your life to do the best that you can, in making those changes that behoove you. Something, either whether it's weight loss or exercise, or the differences, we're having constant UTIs, or we have bowel issues, or depression, anxiety. There's so many.
Mhm.
So that mindset and that motivation is key. But I definitely like to be inquisitive myself, to look at my own practices, and not to perfect them, but to just notice, to be mindful of
Yeah,
what I'm doing. It's
for
okay.
sure.
It's okay to eat the bag of salt and vinegar chips and when I'm hanging out watching a movie, but do I do that every day? And
Mm.
how would it affect my health? And how much am I running? And, I really like to be my own patient as well as a learning tool. Um,
Yeah.
to honestly question myself as something helpful to question others, because I found in medicine, I don't want to be someone who's not physically active, who's not eating well, but who's trying to give someone else advice and
Mhm.
trying to help guide someone by offering them options. um, I just like to be sure I'm doing the work as well, so that I can help them do that in an honest way, I guess.
Yeah, I think people don't need their practitioners to be perfect, but I think if you've kind of been in their shoes a little bit and you've kind of had those mental struggles and you even can share those things and you have the time to connect with people on that level, that all sort of helps to build patient rapport somewhat, and or therapeutic alliance. And I think therapeutic alliance is pretty important because you're you're going to probably get better results if you have it. If you believe the person and believe in the person who's helping you, you're going to stick with their program. With there may be some ups and downs, and really, difficult cases. There might be some trial and error, but they know you're on their team. That really helps. And I think for me, my health journey, I didn't I was struggling a little bit. I was struggling a lot, let's be honest, before I kind of left, and I kind of brewed this idea of my own practice for quite a while. And then, because it wasn't something I wanted to do, I thought that the easier life was like go work for someone else and go home. And I don't have to think about all that business stuff if I just work for someone else. But ultimately I think I can't have everything I want without doing it this way. And so the stress of being a new mom and the stress of a really full schedule and never feeling like you have enough time, I kind of went down the road of like, okay, I had a C-section, so my gut health was a total mess. And so kind of walking a different side, that's like why it's really interesting to talk to practitioners like you, is going at my own health differently than I had before, and really starting to embrace gut health as a really, I think, like maybe like the foundation of what a lot of people should actually be doing in terms of helping not only their mental health but their physical health and their energy. And anyway, that's been a really taking a step back and going, I thought I ate pretty well, but I realized I needed to like do better. And so I think I also like to talk to patients about their diet and their bowel habits and things like that most of the time a lot of PTs aren't going to ask you about, because I think those lifestyle factors are also indicative of whether or not someone's going to improve. You can give them all the right stuff, but if there's some sort of basic fundamental issues that haven't been cleared, or they keep eating Twinkies for breakfast, they're probably not going to see the results that they could.
Mhm.
Um, so having that time with people also helps you dive in and address lifestyle factors that
Mhm.
might be even more important than the exercise that I can give them. I don't know if you find kind of that benefit in your practice as well.
Oh yeah, lifestyle is huge. We talk about work or relationship or, their history, all sorts of lifestyle aspects and how small changes can happen. And it gets when you have more time to talk to them, then you can figure out, oh, it's because, your the partner is snoring all night and all of these different aspects. Like maybe this is affecting, maybe we actually need to address the partner snoring, or you need to address that
Mm-hmm.
as part of the insomnia picture versus just that you're having insomnia and a medication for that. So so I it's the lifestyle aspects are huge, and it makes me continue to want to push it and look at my own in ways which I do appreciate. If you had, I was going to ask you this question because I thought this would be fun to chat about,
Mm-hmm.
like the patients or the clients that come to you that are sort of your typical clients, that would come to you, and I can do the same of saying sort of
Mm-hmm.
these are the people that I think really like what I do from my perspective, from their feedback and desire what I do. Um,
Mm-hmm.
who is that person for you? I mean, sometimes it's pediatric, sometimes it's the elderly.
Yeah, for the most part, I see lots of different ages, not really children, although occasionally teenagers. So maybe teenagers to like, you know, 65 or even 70. Really, I don't think there's an age where you can't improve anymore. I think it's just sort of maybe your goals need to be reasonable, but teens to whenever. I think just by virtue of who tends to seek physical therapy care, not necessarily that it's the only people that should, as I tend to see more women,
Mhm.
because statistically speaking, women tend to seek self-help a little more than men. I see more women for people who are where they're trying to be a little more proactive, and men on a little more of like an acute, like, they have something that's kind of chronic, but it like blows up on them. And I still have to go to work this week. And what can you do to help put this fire out so I can function? Um, so my typical patient is more usually female. And like I said before, they're people who have a variety of issues. Probably again by just sheer percentage, a lot of hip, back, pelvic pain, but also neck pain and headaches and shoulders usually go in there, are pretty common. Um, and 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 the person that usually finds me where I am now is the person who again has tried a few other things and they haven't gotten better, and they're looking for this more holistic whole body approach. Most of their treatments have been really like hyper sort of focused or microscoped on the thing that hurts. And when they come into my practice, I care what hurts, but I care more why it hurts. And I'm searching more for why it hurts. And maybe we don't put like, maybe it's not just one thing, but if nothing else, I'm looking for the hierarchy of what is driving what. So
Mhm.
if you have a body that's, twisted left, right, all the way up and down, something in there is causing a compensation, and then other things are compensating in response. So if I can find the key that sort of unlocks the door that says, well, if I kind of do a little correction in your rib cage, actually your head straightens out and your hip seats into your pelvis. And so I probably don't need to focus much on the hip or the neck. I probably need to explore what's happening in here, because if I can find the tissue or the issue that's driving this problem, I'm going to take care of these problems. And I do that through a postural screen and sort of a specifically finding, little manual corrections or maybe cueing. And then we go through movement. So the person has to have kind of a function that they need to do. So I don't do very well with people that just say, well, it just hurts all the time. Okay, well, I get that. And I know that you may have some pain all the time, but let's talk about what's really important to you. And what's really important to you is that you be able to sit so that you can do your job, so that you can make money to feed your family. Okay, so what is happening in your body when you're sitting? And I'm going to focus on how to help improve your sitting tolerance and sitting function, where someone else might say, I just, my mind goes crazy if I can't run. And so we have to look at that person completely differently if we're going to make them run versus the person that needs to sit, right? Because those would be two different functions. So you have to have I suppose you have to have openness to not focusing on your pain, looking at the whole body. And you have to kind of be willing to think about the functions or functions that are most important to you in defining your goals. Mm-hmm. And that's a pretty big category of people, really, because I'm not as that my niche is more like people who want to do things a different way, which is not a very snazzy elevator pitch, but and aren't satisfied with the results they've gotten from other things.
Yeah,
that's kind of who I'm shooting for, or who I like to help with the skills that I've cultivated. Yeah. How about you? Do you have a perfect patient niche or person that you like to work with?
I mean, I feel the right people come my direction, which is really interesting. Right now I'm cash pay primarily, but I do accept Medicaid. I don't bill other insurances right now, and probably won't ever, but people can get their insurance. They can pay and then submit it to their insurance. In any case, some people say, I don't even care. Like, give me advice on who I should put with my insurance as my primary. I still want to come and talk to you about something. And that don't ever submit anything because they just want a more holistic perspective. I think the examples, I mean, who are like the key people would be a mom about her child would absolutely be key. Someone, women, absolutely, since I was a midwife prior to becoming a family nurse practitioner for all of those years. I didn't even specialize in women's care. I didn't need to. I'd already done it for 15 years. So that's just something that I'll always connect with, I think, as women and mothers. I like to see men. There's less men in that case. Oftentimes I will utilize some other male providers that I know in the community too. I do some and they do some as well. Peds, yeah, I guess it's people who traditionally have questioned Western medicine. And I'm someone who says, oh my God, I love Western medicine because it tells me in some ways, when is an ear infection a big issue? When am I supposed to give an antibiotic? When should that be the primary thing? Because I love to educate. So I can tell a mom, if the child's fever is above 102 or they're above age 2 or whatever it might be, or certain signs and symptoms of something, or maybe a woman with BV or Candida or whatever issues present for her wants to have a more natural perspective of, okay, when do I need to actually take this medication? And I like to lay out Western parameters, but then I like to get very creative regarding other treatments, often natural treatments of something, so that then someone feels really comfortable. They understand the Western, they understand the natural. They might choose the natural for treatment first. And some people say, I just want to take the antidepressant. That's great. I'm not even going to do these other things, but I like the education of both pieces. So I think it's the people that come to me are not someone that goes to just Western or just to an alternative provider, like an herbalist or a naturopath even. It's someone who's like, actually want both of those things and kind of one place. And I know my naturopath comrades are specialists and my functional medicine comrades and my Western comrades that just do Western. They're all amazing at what they do. And I'd say I probably do something that's a sprinkle of all of those things. But it's odd that I am someone who's also really quite Western. And some people are like, oh my God, that's really relaxing to me to think I can go to a more complementary, alternative-ish, that's not the best word, but provider who's like going to lay out the Western parameters of this, how much medication it would be, because I'm also prescribing and need to be very versed in all of that, but willing to talk about what someone's body talk said at their body talk visit or whatever it might be, approaching things more holistically. So it's people who desire that unique medicine, and people are willing to pay cash for that, because also I've kept it very affordable. I was a student and single mom for many years of my life and a home birth midwife. And I have kept things totally affordable, I think, for people, and also very accessible. Another thing, even though I guess in old school days it would be considered like concierge type medicine to have direct contact with your provider, my patients contact me directly on my phone, not necessarily through my personal texting, but through, although plenty of people have my phone number, friends in the community, but through emailing. So say I'm traveling, say I'm camping, say I'm skiing, I always have constant access to a patient contacting. Once they have gotten to know me, they know emailing, they're going to get me same day. And right now at the start of a newer practice, I'm sure yours might be the same way. I mean, probably for another year or so, I'm just really contactable. So it's a very nice thing for someone to be like, okay, maybe I'm just going to go to urgent care. My child is sick and it's a Saturday and Charlotte's skiing with her kids. And she emailed me and just said, go ahead and do urgent care. We'll check in next week. So it's nice that right now I don't have all of those blocks of admin and insurance. And it's a very educated, informed purchase when someone comes. So I think for them, they like that access. It's kind of an old school, it's a new school medicine, but it's also old school. My grandfather was this way as a doctor back in the day. My dad was this way, even as a surgeon, just very reachable, approachable people. And I like to be reachable and approachable and not have a block in front of reaching me unless it's my private time in the evening or whatever it might be. So patients that like that, definitely holistic thinkers. So, and people that want to be educated and discuss things and oftentimes know a lot about a topic. And I value what they know and appreciate what they know because they come to the table informed and ready to discuss things. Oftentimes patients will say, should we check my ANA? I mean, they like put out labs that they know, they put out various things that they know. And I'm like, that's a great question. I think we should, so we're constantly working together in a empowered way. So those are people who like to come to me.
I think that's awesome. I also have sort of chosen to frame my practice as a quote unquote cash practice. And for the most part, some people do just pay out of pocket, and some people, do go through the steps of applying it to their deductible or running it through their insurance. But the reason that I chose to do that was somewhat similar to what you're saying, which is I can make my time more easily, and I can make their time more easily than if I'm focused on trying to, get every little detail down so that I can bill their insurance, and I don't have to make getting paid my primary sort of goal with them that day. I can make being with them and being present with them my primary goal. And I don't, and again, I'm trying to make it affordable. I'm trying to make it sort of consistent with what the sort of cash pay or the pay at time of service discount, if you're speaking the language of a more traditional clinic, is. So I'm not trying to like make gobs of money or become a millionaire, but I'm just trying to do that because it's the best way for me to practice what I think is the best for those people at that time. And I also do have, somewhat like you, I have people can email me anytime, they can text me, they can call me. I don't have, concierge physical therapy, if you will. And I think that makes people, it's an added value for sure. Occasionally, not that often, but occasionally have people text me and say, oh, I did this. Do I need to, go to the bone and joint urgent care, or can I, wait to see a provider, make an appointment? And so you can kind of run through like a little triage with some people on some orthopedic things. And I think that helps, especially right now. People don't have to, rush off to urgent care and worry about COVID exposure and all of that. So I think that it also reflects that people are learning that they can be consumers of their healthcare more than they used to be, right? Like they don't have to go to the PCP that their insurance provider says they have to go to. Say, I have insurance that's largely catastrophic, right? Like if someone gets in a car accident or breaks their leg, I'm not going to lose my house. But as a consumer of healthcare myself, I'm doing a fair amount of cash pay because my deductible is large. And I don't necessarily want the standard line of medical care for everything. Now, if I have a sinus infection and I need an antibiotic, I want that. But I also want someone who then says like, okay, you took an antibiotic. How are we going to, restore your gut health so that this doesn't spiral into a different problem 5 years from now?
Mhm.
So I think that bringing those worlds together is what's really, I think, unique and exciting about businesses like yours and some of the functional medicine people that are getting things up and going in Missoula. And so I think it's cool. It's great.
Well, and sometimes people want to seeing medicine as, consumers. Sometimes it's okay to get, someone is going to pay for some flip flops, that are $20. And sometimes you're like, oh, I want these like really nice boots, and you know what you're getting, and you get this. And sometimes you can even cater to it. I know with some patients, if someone contacts me and says, this is what I have going on again, I know it. It's been chronic forever. I have perioral dermatitis. I don't want to do anything natural right now. I just want to get the medication. How much is a visit? I mean, it's easy to figure that out. And then some things are more complex. It takes more diagnostics. I say I can give you as much time as you want. This is my hourly rate. You can utilize me for 20 minutes or 2 hours, and I'll give you as much as I can of what you desire during that. You definitely want to cover the basics of something, but I like that medicine that's catered to what someone actually wants. So they can say, I'd like to talk for an hour and a half about this. I've been dying to talk about this. Or they say, I really can't spend very much. I want to be super focused. What can we still do something with this? And it's like, absolutely. And I'll even talk fast to try to get it into their 20 minutes. I like the idea of giving someone something that they want, as if you were also a maker or something else. You're an artist, you're giving someone something that they want that's also with your expertise involved. And so what is that? Maybe someone wants to talk to you every week or 2 times a week or whatever. I'll do whatever someone wants to do. That's within a scope of being supportive and healthy and utilizing medicine and the ethical ways that it should be,
Yeah.
because sometimes it's even just support someone needs, especially with COVID. I definitely have like long haul COVID PAX people that have gotten COVID and then after have these persistent issues. And oftentimes it's just the support of dealing with chronic fatigue, of listening and not writing them off. Even though all tests come back normal that we do, it's like, but I know you feel bad. So how do we address how you feel bad, even though we don't have answers to the palpitations or to whatever someone has going on that is plaguing them, or anxiety that they're worried or whatever it might be. If you were going to, I thought about this, I was discussing this with someone at community hospital, that when you're even discussing long haul COVID patients, oftentimes it is the most simplistic treatment that you start with is just listening and validating and trying to hear what their needs might be. And well, that goes with anything with medicine, but especially with the long haul COVID people that don't have any answers. But that's a good example for people that don't have answers to what's plaguing them with their body, especially. I'm sure you get that. Oftentimes it's just a support. Let's try something different. And yes, that diagnostic tool came back, or that MRI came back and says that your knee is fine, but your knee is bugging you. Let's do what we can to try to get your knee feeling better. We've done protocol, and now let's do this. I know people just want to be cared for. So
yeah, absolutely. And I think I think that there's value in feeling connected to the person that's caring for them. Versus, in other settings, you might, if they're not really sick or sick per like medical, diagnostics, you might see your primary care provider or your OB or someone like once a year, right? Be like, oh, your health checks out, but maybe they don't even get acknowledged that, I've gained 5 or 10 pounds. I didn't change my diet. What's going on? I'm not sleeping very well. Oh, well, they take like 5, write a prescription and then off they go. And I think there's a set of people that want a different experience. And I think being able to connect those people with providers such as yourself is important, because they can get what they're looking for, if they look in the right place. And having providers that are kind of on their team or in their circle that are a little more like-minded, so that we're not canceling each other out. Sometimes if you get the person, they say, well, you know, um, I think one example is the person that comes in with back pain, and they have, they've had back pain, and so they go in and they get an MRI or an X-ray, and they're, over the age of 25, so they probably have some degenerative changes and maybe even severe degenerative changes, and the doctor says, well, you have the spine of a 90-year-old, and that person suddenly is like, dropped down 100 notches. They're like, what do you mean? I'm only, 42. I have the spine of a 90-year-old. What's my spine look like when I'm 90? And so I think language that we use is also important. So, having people be a little bit more selective with how they educate people, and truly educating people, instead of just throwing out threatening language that then makes their mind sort of go, oh my gosh, like I'm so broken. Like setting people up for more success through a better way of communicating and having similar language amongst providers
Mm-hmm.
is important.
That's nice. Yeah. And I think when two people believe this, similar kind of language, and it's interesting, people really perk up to it. They get a note and they're like, oh my God, this note's totally different. It's not like this super medical looking thing that I would send them if I worked at a more mainstream clinic. If I had on that hat for the day, I would. If I was working at urgent care, my note would look like this. But, I can send a note that comes from Folk that looks like this, that then works with you where you're at. I mean, I like warm referrals with providers. I think anyone that comes to me, I can clearly say, I have never met this provider. We're going to send you to them. And I cannot say what your experience will be like. Or I like to say, oh my gosh, I think you're going to really like them. And let me know how you like this one that you saw that I've never met before. Let me know how your visit went with Amy, or so, whoever. Because I know that there's also that communication. People gain a lot when there's a warm referral communication, because then we can email. We're not going to spend a ton of time on something, but yet we can at least be like, yeah, she's sounding good, as long as someone's releasing us to talk with one another, or I'm going to actually bring her in and do such and such, or they update. Oftentimes the patients, when they are connected well with the people that they see, they will come and see you and say, oh, I just saw Charlotte last week. We're going to try this step. Or then they come in and see me and say, oh, we just started doing something different. It's actually working really well. And I can just say, stick with it, and so it's this nice connection when you've seen the face of the other provider, when you've seen, you've both seen the face of the patient, I know who I'm sending to, and I know who I'm sending to such and such. And we both know them. That's like a very holistic approach as well, versus just being total strangers, who could be total strangers that are very cool and very like-minded, but it's really neat when you know it as well.
Yeah, for
So
sure.
it's also a holistic approach as well, because then I know what you're saying, and then that I'm also supportive of it too, and I'm not just writing it off with a muscle relaxer and sending them for an MRI or an X-ray. Like, we're kind of getting a little digging more deep as well.
Yeah, which I think there are times, when somebody is in an acute crisis, where a muscle relaxer might be really valid.
Fantastic sometimes, yeah.
Because they are just, their nervous system is just like way too ramped up, and no tool I have is really going to touch it. So not against that, but I do hope that doesn't have to be their go-to forever, right? That maybe that gets them down a little bit, and now we can kind of start cracking that nut, and get down and peel off enough layers that they don't have to, have an acute crisis of back pain every 3 to 4 months that takes a week to resolve.
Well, sometimes people are even afraid to take an anti-inflammatory in a holistic community. And I say, just take it. You actually need it right now. Or if someone has herpes, I'm like, just take this medication. If you're trying to get out of pelvic tension or whatever it might be, just even for a short period, to allow yourself some relief. And then, but not just that. Let's dig deep after that. Once you have this relief and more, seeming control over the situation. And then we can dig more deeper once you're in a better mind space to deal with that. So
Mhm.
there's so many options. I mean, we could talk all night, clearly.
Yeah, we
There
could.
are all options.
Yeah, I mean,
And for 3 hours,
I think
we could go to with the.
right. Yeah, I mean, I think the more that I read, the more I read about and really learn about nutrition, the more I I learn about different supplements to help various things. The more I have these moments of like, I have moments where I'm like, oh my goodness, like what these are such basic things, like what am I going to do for this person? And then I have to take like a step back and say, okay, no, this is what I can do for this person. And maybe this person needs, they need to speak with a nutritionist, or they need to speak with a more holistic primary care provider, or they need to go to functional medicine, or they need to get worked up for something, because maybe this isn't just what it looks like on paper. And so again, that's another reason why I wanted to start these conversations with different providers in town, because the more that I know about you and other people in town, the better sort of facilitator I think I can be to make sure that my clients are getting all of the care that they want, number one, but all the care that they need, maybe number two.
Um,
So
and I like the honesty that you have, like if someone is sent to you, and there's also the self-honesty in it. Like you might say, you know what, I think you need to go to bone and joint PT. I mean, you might be, I'm a provider who says, hey, I actually am happy to still see you, but I do think this other provider may be better for you. Go see them and just see. And if you don't come back, not offended. If you come back consistently anyways and see them also, I love it. Like the more people to work with. And I think that self-honesty, I mean, I've never been a competitive person, just sort of self-competitive, not with others. And I feel like I've always loved for the right people to come my way and other people's way. And maybe this isn't the best client for you or for myself. And that is also a fine thing.
yeah.
I like having the clients that should be there, and in that openness to help them find a nice fit also for them too.
Yeah.
So
Excellent. Well, like you said, I feel like we could probably like kick this ball around all day.
We could. It's
But
fun.
maybe we could like think about wrapping up. I think we've kind of covered a lot of different stuff. Give anybody listening to this, give them the like best way to find you or contact you or schedule an appointment with you, or kind of what that process looks like.
Yeah, that process is the website has an kind of instant email, and I always just tell people, remember Folk. If you just even Google FOLK, or the website itself is www.folkintegrative.com, kind of long, but usually if someone just types in FOLK, anyone can remember that. So then also the Google sort of address and phone number and all that comes up. That's 219-8639. And my email is folkintegrative@gmail.com. It's also on that website. Like very easy contacts. And generally I get back really quickly because I'm constantly checking that myself. I'm not relying on admin at this time. That will change, over the next couple of years. But right now it's really fun when someone emails or calls. I actually get the message and hear it myself. So so it's pretty easy to find me unless I'm outside doing things.
And then you're accepting new clients?
Oh yeah.
Yeah, all the time.
I'm consistently, and I think this year will end up, pushing a little bit bigger. I've tried to almost keep it more tame so that I can manage the kids in the pandemic, but we'll definitely be pushing the practice into bigger places. And I also travel. I actually have a van, and will come to someone's house in the medical van and set up like a little, I mean, this sounds wild, but like a little canopy on top and chairs, and we can sit outside and talk if someone doesn't actually come into the clinic place, the clinic space, or Zoom. So it's a really creative practice, and it's all equally, as formal of a visit. It's just has some relaxing characteristics, whatever feels good for someone that they want to do. So I am willing to travel as well.
Excellent.
So
Cool. All right. Well, thank you so much for spending this time with me today and sharing your perspective and your practice. And
Thanks for having me.
yeah, I look forward to further conversations with you.
Yeah, yeah. And how are you found? I mean, I know we email.
Oh,
How does someone find you? I may as well
yeah.
ask.
So my email or my website is www.inertiaphysiomt.com.
Okay.
And my phone number is 880-7945. And similar to you, this is where they show up. So I try to get back to people pretty quickly. People have questions or concerns about, the practice or the payment policy, which is different. I'd love to do phone consultations to make sure that people are right for me. Um, and help him kind of understand the process and really help them understand how I do is differently. And the website is sort of designed to help them answer those questions as well. But yeah, that's kind of probably the main ways. Or my email is anna@inertiaphysiomt.com.
Thanks.
All right. Yeah. All
That
right.
was fun.
And that was fun. Yes. Well, I hope you have a good rest of your week.
Yes.
And
You too.
yeah, let me know if you have any questions. And thank you for
Okay.
spending this time with me. Thanks,
Yeah,
Charlotte.
of course. Of course. Bye.
Bye.